Welcome to today's special edition of our Live with Leadership series, a community dialogue, June 5th and long-term survivors. We urge all participants to ask their questions throughout the session by using the Q&A function at the bottom of your screen. If you have any technical related issues, please put those into the chat box and someone will try to assist you with your needs. And with that, I will turn it over to Harold Phillips to begin our session.
Thank you, Anne. Good afternoon, everyone. And again, welcome to the Office of Infectious Disease and HIV/AIDS Policy Live with Leadership series. I'm Harold Phillips, and today we mark 40 years since the first 5 cases of what later became known as AIDS were officially reported by the CDC. Today, we honor the more than 32 million people who have died from AIDS-related illness globally, including the 700,000 in the United States. We hope that you will join us as part of today's session to both commemorate the memory of those we have lost to HIV/AIDS and to stand alongside the HIV community. We are also recommitting ourselves to the work that still must be done. We are re-engaging with people with lived experiences and a wide variety of stakeholders from all sectors of society. And we are re-energizing our efforts to accelerate progress and ensure equity. To begin today's session, I'd like to start with a video from the Secretary of the Department of Health and Human Services, Javier Becerra.
On June 5th, 1981, the CDC reported the first 5 cases of what we now know as AIDS. Today, we honor the more than 32 million people globally who have died of AIDS-related illness, including 700,000 here in the U.S. And in their memory, and standing alongside the HIV community, we recommit ourselves to the work that must be completed to end the HIV epidemic. We recommit to re-energizing a whole-of-society effort towards this end. And we recommit to re-engaging all sectors of American and global society in order to meet this objective. Right now, 38 million people, including 1.2 million here in the U.S., are living with HIV. And 40 years on, we still don't have a cure. But we have made tremendous progress since 1981, with advances in HIV testing, research, prevention, care, and treatment. The U.S. government is deeply committed to ending the HIV epidemic once and for all. And in the 40 years since that CDC report, we know that we now have the tools to accomplish that goal. Landmark biomedical and scientific research advances have led to the development of many successful HIV treatment regimens, prevention strategies, and improved care for people living with HIV. Thanks to pre-exposure prophylaxis, PrEP, post-exposure prophylaxis, PEP, and syringe services programs, an individual's risk of acquiring HIV is significantly lower today than ever before. Since the mid-1980s, when at its peak, 130,000 individuals were infected with HIV annually, national HIV prevention and care efforts have dropped that number to less than 35,000 in 2019. And we are making additional progress that we know will bring us even closer to ending the HIV epidemic. New data from the CDC shows that we have made significant improvements in the number of people prescribed PrEP and in viral suppression rates. For example, in 2019, nearly 23% of people eligible for PrEP were prescribed it, up from 3% in 2015. Together, we will continue our whole-of-society approach, and we will engage populations which bear most of the HIV burden, including gay and bisexual men, Blacks and Latinos, transgender women, and those living in the southern U.S. Domestically, we'll continue implementing our initiative, Ending the HIV Epidemic in the U.S., which aims to reduce the number of new HIV infections in the United States by at least 90% by 2030. And through PEPFAR, the President's Emergency Plan for AIDS Relief, which has saved more than 20 million lives, we will continue to contribute to ending the HIV epidemic worldwide. We have made remarkable progress in preventing and treating HIV in the U.S. and around the world, and it has been built on the shoulders of the early pioneers of the modern AIDS movement, who gave their hearts, their souls, and many of them their lives, so that we end the HIV epidemic. Together, we also honor the resilience and diversity of those living with HIV and the HIV service community, which makes a world of difference. But the work is not finished. HIV-related stigma remains a significant barrier, and the COVID-19 pandemic has slowed and threatened hard-won gains. I'm excited to engage with members of the Biden-Harris administration and with leaders across society to take steps necessary to end the HIV epidemic. Thank you.
Thank you. So now we've heard comments from our Secretary of Health, Secretary Becerra, in honor of the 40th year of the AIDS movement. So today, as part of our Live with Leadership series, we'll hear from several long-term survivors. We're looking at this as more of a conversation among friends, both honoring those that we've lost, thinking about those living with HIVs, as well as honoring long-term survivors day. And so as part of this, there are several panelists that will be joining me. And as part of our discussion, we'll also, I know I have myself, spent some time of this day, which is bittersweet for me, thinking about those friends that I have loved and lost over the number of years, also thinking about my own 16-year journey with HIV and living with HIV and what that's meant. And as Secretary Becerra said, there's much work that still needs to be done. I'm committed to doing that work, and so are the panelists who will join me today. So first, let's start with Gina Brown from the Southern AIDS Coalition. And so Gina, there she is. Hello, lovely.
Hello, Harold. Hello, everybody. I'm Gina Brown. I was diagnosed living with HIV April 4th, 1994, when I was pregnant with my daughter. Thanks to the biomedical advances, my daughter is not living with HIV, but that does not mean that she cannot contract HIV. So we keep honest conversation going in my household all the time. I am the Community Engagement Manager at the Southern AIDS Coalition. SAC is an organization based in the South. Our mission is ending the epidemic, and we do that through many different buckets. And my bucket is leadership and education development. So I'm on the ground working with people living with HIV and those most impacted by HIV. In my 27 years of living with HIV, I have worked almost every part of this care system, from peer advocate to what I'm doing now. And I'm really happy to be here. Thank you, Harold, and thank you, panelists, for having me.
Thank you, Gina. So Arianna Lint from Arianna's Place. Arianna, thank you so much for joining us. And can you introduce yourself?
Hello, Harold. How you doing, everybody? My name is Arianna Lin. I am very proud to right now, as a transgender woman, call myself a long-time survivor. Many of my sisters and siblings in the community, they don't have the opportunity at this time. Arianna Center is the only advocacy and service organization with the mission of support and empower women of transgender color in Florida, Puerto Rico, or whatever such services are needed. We provide outpatient HIV testing and prevention services, begin to available to connect those services when we also support social work, need change, referral for legal help, and access to medical health and emotional health. We also provide shelter for trans women who have been detained by ICE detention center, incarceration, and have any type of problem. We provide a scholarship to pursue high school via GED plan, and we also support technical careers and advice on how to enter to the world of work. We also train our trans and LGBT community and advocates, making them more active at the political level, support elected leaders of the government, and establish policies and laws to ensure the well-being of our community, and new laws for better quality of life, specific HIV decriminalization. Lately, we have started offering digital program on social media to connect more deeply with the community and with our own leaders. For me, it's a pleasure to be with so amazing panel of panelists and long-time survivors. And thank you so much, Harold.
Thank you, Arianna. And next, Mr. Jesse Milan.
Well, Harold, thank you so much. And before I talk about me and my work as the CEO at AIDS United, I want to talk about you and send a shout out of congratulations for the announcement going out today that you are the new director of the Office of National AIDS Policy at the White House. We could not be more elated or more proud to have you lead this movement for us at the federal level. So congratulations to you, Harold. But I'm Jesse Milan, and I'm the president and CEO at AIDS United, which is a national organization focused on ending the epidemic in the United States. And we do that through our strategic grant making. Over the history of our organization, we've given away approximately $120 million to community-based organizations. And our capacity building helps organizations do better at achieving their mission. And our policy and advocacy work works with Congress and the administration for the policies and appropriations necessary for ending this epidemic in the United States. But this anniversary today is especially meaningful for me because I graduated from law school 40 years ago this month as well. And so my whole life and career has been bracketed by this epidemic. Within 1 year, in 1982, I acquired HIV myself. And so I've been living with HIV for this year, 39 years. And shortly after that, in 1985, my late partner lost his life to AIDS. And so my personal and professional careers have been intertwined with this since the very beginning. As a young lawyer working in Philadelphia, helping to advocate and teach the community about the rights of people living with HIV, including helping our community understand how to be prepared to die with AIDS if necessary. And then over the years, I've been blessed to have many leadership positions at local levels in Philadelphia as AIDS director for Philadelphia, at the national level as director of the National Prevention Information Network, and being chosen by the State Department to be an HIV expert, to talk directly to people in Africa, to do 3 speaking tours of 7 African countries, and to chair the Federal Advisory Committee for the CDC and HRSA on HIV and STD prevention, treatment, and care. And now, as president and CEO of AIDS United, I have the wonderful opportunity to work in partnership, not only with funders, but with federal level officials and with advocates from all across the country who come together through our AIDS Watch to tell the story of what 40 years of HIV means and what is needed for ending the epidemic. And I'm thrilled to be here with Gina and Arianna.
Thanks, everyone. And it's great to have you all here today. We've got a couple, we're gonna do this as part of a discussion, and then we will later open it up for questions from the audience as well. In addition to the video from Secretary Becerra, after this is all over, we encourage you to go to hiv.gov, where there are additional videos that are commemorating the 40 years of the HIV movement, including one from Dr. Fauci. But, you know, even I think in Secretary Becerra's comments, he mentioned the issue and the work we still have to do regarding stigma. And I know that everyone's HIV story is different and unique, but stigma is one of those things I think that's common across, you know, all of our experiences. And so I would invite one of you to turn back on your camera and tell me about a time when you were facing HIV-related stigma, and what, you know, what strength did you draw upon? What tools did you draw upon to help you get through it? Maybe Arianna, you want to go first?
Yes, sure, Harold. Let me tell you something. Let me explain my own history. I am part of the of the stigma when I'm becoming HIV positive, and I truly fight with that internally. And when the only way I can external and break that stigma is with education. For me, HIV is not the issue, or is not a problem. The problem is we are not educated about it. That's why my commitment is with my own transgender community, because for us, we still in 1981, 1982, we just have a leadership in the HIV field, but we need a more equity for us. So I think when we're working in the stigma, you're going to work with the most vulnerable communities in the United States, specific Latinx community, transgender community. And the only way to break the stigma is through education and through these spaces to show to the public, people, tell them the HIV is, you can live with HIV, you can do whatever. I am so proud to be worldwide speaking person for the campaign You Equal You as a transgender woman. This is amazing for me. This is so how we can working together and end the HIV soon. Working all diversity together.
Thank you for that, Arianna. Gina?
Yes. So I conduct a training here in the South called the Unity Workshop, and Unity is a training that we use to dismantle stigma, and we teach people not only is stigma external, but a lot of our stigma is internalized stigma, right? It's all of those things we think about ourselves. So we teach people to get rid of the negative thinking. We write it down on a piece of paper and we actually take it out of the room. So we get rid of the negative words and we replace them with positive words. I can remember my own instance. Well, I've had many instances where stigma was, kind of controlling me. But once early in my diagnosis, I was on a bus. And here in New Orleans, it gets very hot, especially in July. And these girls were on the back of the bus and they were talking about this boy from the project. And they kept saying, so-and-so have that gangster. And in New Orleans, that gangster is HIV. So I started sweating and then I got nervous and I thought if they looked at the front of the bus, they would see me and they would know I had it also. So I rang the bell to get off the bus and I started walking and I realized I had like a mile to walk to my destination and I got really angry with myself because I said, they didn't even know you were on that bus. And I don't think you can look at a person and tell. But I had to work through that, those internalized feelings. And the way I got rid of my external stigma is I went on TV and I told everybody I was living with HIV at the same time. And the experience was really positive, but it's not like that for everybody, especially here in the South. We're in the Bible Belt. We have a lot of religion. We have a lot of people, a lot of homophobia, transphobia. We have anti-Black racism. And all of those things impact people living with HIV. So stigma is one of those things that we have to continue to work with people around because that's the thing that keeps you in care, keeps you on treatment as prescribed, and just makes you feel good about yourself.
Jesse, anything you want to add to that one?
I think so much of this stigma, both internal and external, is rooted in fear and ignorance and judgment. And overcoming those both internally for ourselves and for the community really are the challenges around stigma. I was so struck this past week with the announcement by Billy Porter, this big Broadway and Hollywood star, that he knew of his HIV status for 14 years, but never disclosed it until he got to the point where he could disclose it in comfort with his mother. And frankly, that's also part of my own story of fearing the fear and losing the love of the one person you fear the most to lose. And frankly, with my own mother, I had to do some education before I even told her. And recognizing that once that education was done, that I was in a safe space, I found that my own internal stigma dissipated and I had nothing more to fear because the one person I feared to lose the most was going to stand with me. And so I think we have to do a lot of education around the fear and the ignorance and the judgment with others so that they can support us and deal with the fear, the ignorance, and the judgment we have on ourselves. by making sure we are in a supportive environment, including working with other people living with HIV who can help lift us up. The external and the internal have to be addressed if we're really going to get over stigma.
Absolutely. Thank you for mentioning both the external and the internal stigma. And I know this is something that, you know, as we talked about in my opening question about, this is something that's common that all people living with HIV have to deal with. I know personally, realizing my own internal stigma once I was sort of with some nieces and chopping vegetables and accidentally cut my finger. And I remember them sort of wanting to help me and me being afraid of my blood and totally irrationally knowing it. And it just sort of hit me. But this was all before sort of the U equals U message, which has taken a lot of sort of the stigma out of, for I know both self-internalized stigma, and I hope also stigma, it reduces stigma out in the community. But as sort of the research and the science has talked about the importance of viral suppression and what that means for someone not passing HIV on to their sexual partners, what has that sort of meant to you all? And Gina's come back on camera first, so I'll start with her. Gina, anything you want to talk about with in terms of that and what we know now about taking your medicine regularly, consistently, and having that low viral load?
Yes. It was not until I heard about U equals U that I even felt normal, or I'll do air quotes, normal, whatever that means. I'd always wanted to feel like I wasn't an infection. I always wanted to feel like it was safe to be around me. And I didn't have that scientific knowledge until I heard about U equals U. And I asked my doctor one day, we were talking, and I said, how long have you known about U equals U? And she was like, well, we kind of knew a long time. And I was like, why weren't you telling people? Because that makes a big difference in how we view ourselves, how community views us, and how we actually, what we do to maintain that undetectable viral load, right? So I take my medication every day. If anything is going on with me, I write it down and I'll talk to my doctor about it. So it's all of those things. But it really made me feel like now I can get in a relationship. Now I can be in a relationship and disclose my status in that relationship, and the person doesn't have to run away from me. And it was enlightening, and it was freeing, knowing that being undetectable meant that I was untransmitted. I could not transmit HIV. Just makes me feel better.
Arianna, I know you also said that you are a U equals U ambassador. So, please feel free to jump in.
Sure, thank you so much. Listen, as a transgender woman, as an immigrant, for me, is feeling like ambassador for one of the campaign who they are really make a difference in the HIV field. And then the work is amazing. But let me tell you something. I am, in the beginning, was very afraid to talking about my status. And I don't know, one day people told me you are indetectable. I don't know what that means. But when I start visiting AIDS Watch in Washington, D.C., and meet same people as me, talking and advocacy, and meet with representatives, made me the empower. And I remember one day Linda's group told me, what are you doing here sitting in Florida? You have to go nationwide and talking for your community. Fight. And as a transgender, I feel like obligation that, but now I'm feeling so happy to join the amazing people and talking about community viral load. I was last week made the first historical training in Spanish, a blog training by HERSA, and I was one of the faculties to talking other emerging leaders, activists in Puerto Rico about the stigma. And listen, look my skin. It's so amazing to, as a transgender woman in the beginning, do nothing and know nothing about HIV. Now I can work for my community, and I can be appreciated for people like you, people, organization like AIDS United, like Southern AIDS Coalition, like really, really helping and empower my work and my community. So I'm very humble and I'm very happy to be here, but also educate others about the importance to be undetectable, you equal you, and community vital.
Wonderful. So let me ask another question, because this comes up sometimes a lot, especially in the federal space. And sometimes the federal government gets criticized for focusing on sort of viral loads or lab values and not thinking about sort of the quality of life of long-term survivors. So I'm going to ask a different question. So what do you do to help maintain or improve your quality of life? And then my second question is, what do you need from the federal government to help improve the quality of life for people living with HIV?
Harold, I think that's a wonderful question, because once again, it creates a sort of bifurcated approach. What does the person living with HIV need? But what does the person living with HIV, what kind of environment does he or she need and want to live in? And so for, personally making sure you make the right choices to take your meds every day, to get your labs as prescribed by your physician, to take charge of your own wellness by, doing the exercise, reducing the smoking, making sure that your mental health and your own personal environment are ones that support your overall health and well-being. But we know that's a challenge for many people living with HIV. And so the bigger environmental question is to what is the society around us? What are we teaching others about HIV? What do they know, including, is the message about you equal you only a message for people living with HIV? Hell no. It's a message that not only our future sexual partners need to know, but so do your nieces when you're chopping vegetables for the Christmas turkey. I mean, and that helps dissipate the stigma. We need that environment, but we also need to make sure that we have the funding for the social supports necessary, housing for people living with HIV, the continual support for the Ryan White Care Program, and expanding it so that the long-term future for all of us aging with HIV is not just about what we need for today, but what we might need for the next 10, 20, or 30 years of a normal lifespan.
And I would just add also, we need the federal government and everyone to look at HIV as a medical condition and stop thinking about behaviors. Yes, there are certain behaviors, we know that. But if you think about a woman, a Black woman who's living with HIV, 9 times out of 10, she found out when she was pregnant. 9 times out of 10, she contracted HIV in a heterosexual relationship. Whether it was sex with one man, because even if she had sex with 100 men, it still only took one person for her to contract HIV. So having that conversation, stop talking about risk as in risky sex. The only thing risky about sex, and I say this all the time, is hanging from a chandelier, because if it breaks, you hurt, or in the middle of an interstate, because people will be so busy trying to look, they'll run you over. Sex is sex, and we have to start talking about it like that. HIV is a medical condition that if we do certain things, it may become a part of our life. But we have to have that conversation. And another thing I think my community needs is making sure that there's adequate food. We talk about you equals you, and we talk about being on treatment. But if you're on medication that says take with food and you don't have a slice of bread in your house, and you have to take it with food, you may not take it. So making sure that where there are food deserts, we have food pantries. And where there are food pantries, we have abundant amount of food for people.
Yes, and yes, I want to add, addition with the amazing words of Jesse and Gina, I think as a transgender person and representing many of transgender women, I think the leadership and the meaningful involvement of the transgender community is crucial in the federal level. After Cecilia Chan resignated the PACHA, we don't have no transgender voice to advise the presidential voice. And when I'm talking about transgender, specific have to be openly HIV and living in the South, because the difference in the South is totally other world for other part of United States. So we have, I'm representing many of openly transgender women living with HIV, Diana Michelle in Puerto Rico, other amazing women in the South who they are trying to implementing the leadership and give advice to working together. We are not the problem, we are the solution.
Thank you very much for raising those issues. Thanks for sharing some of those thoughts. Right now, we've got some time for questions from the audience. And this, I think, goes along with some of what we've been talking about with regard to quality life. And it's a question about what HHS should do about older people living with HIV over 65 who need better care in the care system to meet their needs, and those people living with HIV who are suffering from premature aging and greater numbers of comorbidities and mortality.
Well, one thing I'm hoping that the federal government will do, and perhaps you may help with this advocacy that AIDS United is actually starting, is with the HOPWA program, which is not in the Department of Health and Human Services, but in the Department of Housing and Urban Development. The HOPWA program is not yet prepared for HOPWA resources to be used for assisted living, for independent living, for people who qualify as seniors. And you know, my father was in an assisted living facility, and when I went to it, I kept thinking, should I live here when I'm 80 or 75? And if so, will they be prepared to deliver the meds to me every day that are for HIV? Getting our senior system ready for people aging with HIV is critical. And not just the HOPWA program, but the Medicare program as well. Making sure that I feel comfortable that all the meds I'm going to need for the rest of my life can be paid for through Medicare. Those are the preparations we need to do now.
Thank you for that. Another question is, can anyone speak to how stigma has changed over the years? In the early days, it was largely about fear from others who don't know how HIV is spread. Is that still true, or to a lesser extent? And does it seem to come from within our own community?
Yes, it's still the same. It's still the same. People still are not educated on HIV. They still don't know how you contract HIV. Anytime I'm out doing a talk and it's with community people and I ask the question, how do you think you contract HIV? They're gonna always say mosquito bites and saliva. And then that leads me into giving the real information. But we have to do that consistently. You know, we have to start with my grandson. I've been talking to him since he was like 7. So we have to educate people, but that's one way to get rid of the stigma, right? By educating. But another way also is by looking at the role we play. So the words we use. You know, I was so happy to hear Secretary Becerra say people living with, you know, y'all know it was somebody in the government who kept saying HIV positive. Everybody wanted to get them, you know. So just listening to what we're saying, not using stigmatizing language. So we try to teach that, but I still see the same stigma. I still see people who have to use paper plates, who have cups they have to throw away, that when they leave out the restroom, they can hear somebody go behind them with bleach water. So those things are still happening. We just have to educate.
And I know, Gina, you're in New Orleans, Arianna, you're in Florida, and I remember meeting a guy in Tennessee who worked as a chef at a food pantry in a church. And when they found out he was HIV positive, they fired him and let him go. This was several years ago, maybe 10 years ago. But can you talk a little bit, Arianna, about what you experienced in the South in terms of stigma? Is it better? Is it about the same? Like Gina is saying, so definitely around the New Orleans area, it has not changed. And we still got a lot of education to do.
Yes, as you mentioned, I'm in Florida. So you know how it's in Florida right now, and they don't change. They don't change. The stigma is one of the big issues. That's why my commitment and tell openly my status to break the stigma, not just when inside of my community, but outside in the society, in the society, and also working specific and change the law or the policy. We make a historical face-to-face conversation. We bring more of 20 transgender individuals to Tallahassee, thanks to one of the programs of AIDS United granting us. We make historical before the pandemic, and we working with the one of the state representative, Piso, about the HIV decriminalization, because it's important to break the stigma has to be shown and equal in the laws. And in Florida, it's terrible. It's terrible. And laws start with the stigma too, so people, it's so difficult, specific for vulnerable communities.
Harold, I look forward to a anti-stigma campaign that doesn't feature people living with HIV, but people who love people living with HIV. I want the anti-stigma campaign with mothers and cousins and your nieces, my nieces, that says, I know someone living with HIV, I'm related to them, I love them, and I'm not afraid of them. They are part of my family. And that's the message we need to empower our allies to say, and giving them the construct and giving them the platform to say it, because, Gina, Arianna, and I, we have those people in our orbits, but are they empowered to say it to someone other than just us? Are they empowered to say it to the people they live next door to and the communities that they live in and even the pews that they sit in? That's the kind of, I think, anti-stigma environment that we want to create.
I think that's great, Jesse. And I know that they're having done some work on global HIV. There have been some countries that have had campaigns like that, where mothers and aunts have talked about, their gay sons and the importance of testing and PrEP, or supporting their sons and their brothers and their uncles who are living with HIV. And I think, perhaps trying to do something like that in the United States could be really effective. And I think, for those who don't have those kinds of family supports, having that chosen family of friends and allies that can be with you and be supportive and check in on you, bring your food, make sure you help take your medicine, tell them how much they love and care about you, is still also important. We've got time for a couple of more questions. And one of the questions is, what do you suggest be done in order to affect policy change at a state legislative level? Is there anything that any of you are doing or know of that can especially help us with some of the state legislative issues? And I'll bring up one that also has been mentioned in one of the questions, the issue of HIV criminalization. Are any of you doing work in that space and can talk to the audience about some of the things that could be done on the state level to help make a difference?
I think.
Yes. I'm sorry, Jesse, go ahead.
Well, I think one of the advantages of one of the unexpected positive outcomes of the pandemic is operating in a virtual world where people are operating from their home base as opposed to traveling to Washington and other places. And so with AIDS Watch, which is the oldest and largest national advocacy event to address Congress and the administration by bringing the voices of people living with HIV directly to decision makers, in this virtual environment, those advocates have been in their home jurisdictions, and we've given them the space, and we're helping to mount the training for them to tell the stories in their districts, not only to their federal legislatures, but also to their state legislators, and if necessary, even to their city councils, because authorization for SSPs, for syringe service programs, criminalization issues, and the failure to expand Medicaid is a state and local concern. And the more we take and tell our stories to our state legislatures and to our city councils, the more we have the possibility of changing the policy environment in our home jurisdictions.
Yes, and I was just gonna say, at SAC, we work with what we call a HANDS network. So it's HIV/AIDS in the Deep South. And these are networks. Louisiana has one, Louisiana AIDS Advocacy Network. North Carolina has NCAN. South Carolina has the South Carolina HIV/AIDS Task Force. And these are all groups of people who come together and look at their state policies. And they go up and they advocate, they educate each other on what those state policies are. We go in and we look at the states that are still criminalizing HIV and get with Zero Project and people like AIDS United and make sure that we're amplifying the voices of people living with HIV in those states to talk about that, teaching people how to storytell. You know, everybody's not a natural storyteller, you know, giving people those skills. And making sure that we are staying in touch with them as they're moving that process along. Because sometimes you can get a little frustrated, you know, because you don't always think they hear you when you're talking, you know. So making sure that an organization like AIDS United, like Zero, like SAG is holding their hand as they're going through the process. It means a lot.
Thank you for that. And Gina, I'm going to ask you to take this one. What advice, because this is right up your alley, what advice would you give people who are in the process or have recently had their sexual debut?
Well,
oh, that health education thing now, just briefly.
Yes.
Where can they get more information, or what's key, I think?
The key thing about sex is not to be ashamed of it. You know, it should be enjoyable. It should be pleasurable. It should be something that when you think about it, it makes you smile, you know, and if you're not feeling those things, then it's good to talk to somebody about it. Whether it's a provider or your case manager, or whoever you feel comfortable talking to. I would say, like, if it's a sexual experience outside of what I lived most of my life. So most of my life I lived as a heterosexual woman, and it wasn't until 2018 that I came out as bi, even though I've always known I had those feelings. So anybody who's experiencing that, you know, talk to somebody who recently came out, or who came out later in life. And just surround yourself with people that affirm you. You know, there's nothing we're doing that's wrong. And we have to be able to tell that to people, that they're not doing anything wrong.
Right. Right. Thank you. Thank you very much. I know there are a couple of folks who said they would love to advocate with all of you all and also get some more information about how to work to change laws in their local areas. You can also, audience, go to hiv.gov to get more information. There are also locators on hiv.gov where you can put in your zip code and get access to HIV education, HIV testing, HIV services. And so there's also that as well as the ability to reach out and contact some of our panelists today, for those of you that are really interested in either working on the federal level and learning more, or working on the state and local level too. With that, I want to thank you all very much, and I'll ask you to come back on in a moment. But before we wrap up, as part of our commemoration of these 40 years of the HIV movement, I'd like to show a video by one of our partner organizations, the National AIDS Memorial. The National AIDS Memorial is a terrific organization that ensures that the lives of people who died from AIDS are not forgotten, and that the story of AIDS is known for future generations. And so they have put together, they're having their commemorative celebration or ceremony today. Yeah, celebration is probably right. Celebration of the lives of those that we have lost, and a commemoration as well. And they are unveiled the 6,000 panel quilt honoring those we've lost. So we're going to take a moment and take a look at the video right now.
The worst thing in those days was the continual drumbeat of death and illness.
People were just dying all around us.
It just seemed like my whole existence was being wiped out.
And as an HIV positive man, I just knew that I would be next. The worst of the AIDS epidemic was in the 80s and the 90s. People were dying all around us, and it was like being dropped into a war zone.
I went to a lot of memorials, a lot of tears.
I lost all, friends, lovers, family, you name it.
I literally froze in my own place for the fear that I would be next.
I fully expected to be dead.
I could talk to no one about it. I had so much shame in the beginning.
I actually felt dying would have been the easiest thing to do, because then you wouldn't have to watch everybody dying.
In 1996, protease inhibitors came along and changed the game. People stopped dying in such huge numbers.
I believed in them because when I started them, I had 7 T cells, and 2 weeks later, I had 280.
I realized that I was going to live long enough to buy a car and be able to make all the car payments.
It sounds like it should be one of those, oh, be grateful, have a party, you're going to live. It was the exact opposite. It sent me into a tailspin.
You cannot watch that many people die. You cannot watch the injustice that we watched and not have that affect you.
I experienced a deep depression that I didn't recognize, and I didn't know how to get help for it.
Once the worst of AIDS was over, things subsided, people were moving on with their lives. Though that moving on was difficult for a lot of us.
46 to 48% of us deal with depression, suicidal thoughts and tendencies,
Anxiety, lack of future orientation, not being able to imagine being an old person. It would be wrong for me to talk about how sad and how tragic and how just, confusing it was without talking about how beautifully people came together and took care of each other and formed a community that was very strong and resilient.
We had to take care of ourselves, and I think that was the tipping point, was when we began to learn how to take care of each other.
We showed the world how to handle AIDS. How do we treat AIDS patients?
I certainly honor all of the organizations that are still trying to do work with people with HIV and AIDS.
But now it's like, because we're living, and it's a fact, because we're living, there's a lot less funds devoted to these agencies.
Society in general, when the medications came, shelved us all. They wanted us to shut up and go away.
It startles me. It wasn't, 20 years ago, and people are acting like this never even happened.
We're going to go into retirement and aging in poverty, and no one's prepared.
Of all the things I planned on, the one thing I didn't plan for was being alive and thinking about retirement.
We have to show the world the way, the path, again, how to take care of elderly with AIDS.
Whatever we didn't get right in the first part of the epidemic, we can get that right this time. I am taking all of the knowledge that I have gathered and using that to try to recreate community, rebuild my life, and build the future that we're so scared of.
I'm an AIDS long-term survivor.
I'm an AIDS long-term survivor.
I am an AIDS long-term survivor.
We're still here.
We are still here.
We're still here.
We are still here.
We're still here.
I'm glad they're still here. It's wonderful seeing that video and seeing people that we've known for quite a long time still here, still active, and still full of hope for the future. Before we wrap up, I'd like to ask each of our panelists to take just 1 minute and tell us what gives you hope as we look forward to the future and the end of HIV. Gina?
What gives me hope is U equals U in PrEP. PrEP has been a game changer. We just have to make sure it's changing the game for women, especially Black and Latinx women. We have to educate women on what PrEP is. It is not something that if you're going out and having sex with 100 men, is if you're going and you're having sex with someone whose status you don't know. It is to protect you. It doesn't mean you're a tramp or anything else. This is about your health. And we have these biomedical breakthroughs and biomedical advances that we really can end this epidemic.
Wonderful, thank you. Arianna?
What they give me hope is be part of the amazing leaders, trans leaders, and the whole United States, Latinx and brown leaders, women who they're running trans-led organizations and working together to end the HIV pandemic. That is what they give me a hope. They give me a hope when organizations they are don't cut the bridge with the transgender communities, or they building the bridge to help the transgender community. So I am so happy to call myself as a transgender woman right now, survivor, and tell to everybody, transgender community is still here too.
And Jesse?
Well, Harold, you and your new role give us all hope that the voice of people living with HIV will have a meaningful leadership role for the future in this administration. And we know we have the tools for ending this epidemic. We have the biomedical tools, we have U equals U, and we have PrEP. But do we have the personal will and the political will to end the epidemic? The personal will to tell our stories not only as people living with HIV, but people who love and are concerned about people with HIV. And do we have the political will to continue the advances, not only in health, but in human rights, so that all of us can be healthy? There will be no more transmissions, no more deaths, and no more stigma and discrimination from HIV and AIDS. It gives me hope that we are on that trajectory, but we have not reached the end yet.
Thank you, Jesse. Thank you, Arianna, and thank you, Gina. I also want to take a moment to thank the crew behind the scenes who helped pull all of this together, Burnett Garcia, our team, contractors and staff in the Office of Infectious Disease and HIV/AIDS Policy. And I also want to take a moment and just say that, for me, one of the things that gives me hope, all of those who've reached out today and sort of just reminding me that they're there and that they're ready to help as we roll up our sleeves to do this work. I am reminded and hopeful of the ability to bring folks together that I have worked with throughout a number of years so that we can continue in this effort to work toward an end of the HIV epidemic and improve the lives of those living with HIV. And that I am honored to represent all of you all, and I will be calling because this can't be done alone. So those friends, those colleagues, those who we've worked side by side with over the years, I'll be calling on you all to help in this effort because I think the time is now. If we're going to get this done, we've got to do it and we've got to do it quickly. So thank you all for the encouragement and the support. We hope that you'll continue to be reflectful of today, but also know that we're going to roll up our sleeves and get to work on Monday as we work toward the end of the HIV epidemic. Thank you and have a great day.